been a little bit since I've seen you, huh? Let me just go ahead and grab some sanitizer real quick. Okay. Do you need any? All right. So how have you been? Okay. Do you have any time to check out any of those therapies that we had discussed? Okay, been a little busy. That's fine, that's fine. So what am I seeing you here for? Gotcha. Okay, so we kind of want to revisit that. Alrighty, that's fine. Let me go ahead and let's get some of that paperwork out of the way again. So just for security purposes, what was your name? Alright, and your date of birth. Okay, yep, good to just confirm. There we go. Alright, and that was your preferred name, correct? That's what I remembered, and your preferred address. There we go. Okay. So, reason for visit. Okay, that's excellent. So, would you mind just telling me a little bit about what's been going on, how you've been feeling? Okay. All right. Okay, certainly. So we can check a little up on that. So has there been anything significant, and you don't have to tell me, anything significant physically, emotionally, anything like that, financially, with you recently or with somebody that you know? And this could even mean like successes, believe it or not. Even good stress, good energy can sometimes make you a little out of whack. Yeah. Okay. Okay. That's fine. All right. So I think with you today, we're going to do a little checkup again, but we're going to focus primarily on your energy, okay? And we'll bring out some different things, I think, since we had a pretty full workup with you last time. So I think, let me just go ahead and I want to just make a couple notes here. There we go. All right, that's good. Okay, so I'm just gonna flip back. All right, very good. So all of that is in order. I was just looking up some documentation that I had and some different tests that we have that we can do. So let's go ahead and get you all tested, okay? So what I want you to do is I want you to get a little loose, a little relaxed, a little comfortable, okay? So if this means shaking out your shoulders a bit, your hands, your feet, okay? If it means just kind of rolling your shoulders back a little bit, widening the rib cage, all right? Just anything that really loosens you up and prepares you to be alert and ready while still retaining relaxation, okay? If you want to just take a moment and, shake out any excess tension, anything like that, okay? All right, you're all good? Okay, you're as comfortable as you can be? Very good. So I first noticed right here, Okay, so you have quite a bit of tension in these two areas, and I can tell that from the slight prominence of your muscles when you are unknowingly clenching your teeth or unknowingly clenching those muscles. Okay, so what we're going to do is I'm going to touch these areas so that you understand where on your body you're holding that tension, and we're going to try to relax that. Okay, so right here, right along your temples, this is the temporalis muscle, right? And oftentimes this gets engaged when we are chewing or when we're clenching our teeth. Okay, it can be a little bit of a sore spot. So I'm just very gently touching this area. And I want you to just notice this area, and I want you to relax it as best as you can. What this could mean is you could let your jaw drop a bit, or you could stick your tongue in between your top and your bottom teeth, like that, so that you have that space in between your teeth, so you're not grinding down, you're not clenching, it's just relaxed. Okay? Right here, that's what we want to relax. And then we'll also bring that down to right here, into the masseter muscle, into your temporal mandibular joint, right here, the TMJ area. Okay, so just work on relaxing that jaw. Let your mouth drop a bit. Let your jaw drop a bit. And focus on letting the tension in these areas go. Okay? Just let it go. Let the tension go. Alright? Okay. So another thing. I can see your shoulders are hitched up a little, which is something that we often unconsciously do. So I'm just going to press your shoulders down, okay? You don't want them hitched up towards your ears. You want them down. You want them rolled back so that your chest is open. It's a funny thing when you hold yourself closed off like this. If you do something a little like this area can get really tight. Sometimes you can experience chest pain, which is no fun for anybody, right? Because you don't know what's going on. And sometimes you can get some tension in your sternum area. You can experience that tension all along the clavicle. Just not a fun area to have really tense, okay? So I'm going to press your shoulders down, and then we're going to roll them back, okay? So we're going to press down, roll back, all right? Press down, roll back, all right? Just like that. So what we're going to start with is I'm going to first do an energy scan with a pendulum right here. So when the energy is blocked in your body, this pendulum will swing oftentimes back and forth, like that. When the energy in your body is clear, when everything's open, your channels, your meridians are open, it'll swing in a clockwise direction, that way. Not the way previous, but this way. A clockwise direction, okay? So I'm just going to be holding this over your body, and we're going to see how the pendulum swings, okay? And from there, we can kind of determine what's going on in your body, why you're having all this tension, all this stress, okay? All right, so far, all of your energy centers seem to be dealing with some blockage, which happens to the best of us. Okay, I'm going to go down one arm. Okay. So there's not as much stagnation here, but there's certainly something going on. And it has been a little bit since you've seen me, and you've said before, haven't really been able to do any of those therapies, which is fine. I did see a note about the healing touch therapy. Did you happen to catch that? Okay, all right. Yeah, they do use this technique as well. Okay, I'm just going to note that down real quick. So, okay, excellent. So now I'm going to scan over your body with my hands. What I'm looking for is any shocks or any prickles of energy. So we just kind of want to feel what's going on, okay? So our pendulum can tell us if things are blocked or if they're running smoothly. This will give me a little bit of a better insight into what exactly is going on. Okay, so just sit still for me. If you want to close your eyes, you want to keep them open, it's all up to you. Okay, just going to be slowly bringing my hands down. Okay, so already there's just this heaviness right here. Okay, that's interesting. Okay, and right in the throat area, I can see that. It's a bit itchy feeling. Okay. There's certainly some things that we can discuss and we can work on. Okay. Yeah, I can feel that. All right. That tells me some different things here. Okay, so that gives me a better idea. Let me go ahead and take some notes and we'll discuss further. Okay, so what I noticed is we had a little bit of heaviness, a little bit of fogginess, stagnation. It just felt kind of turbulent, if you will, right in the third eye area, right here. So your third eye is linked to like psychic intuition. It also can be linked to imagination and creativity. So there's something going on right there, okay? As well as your throat chakra, that had a lot of prickliness to it and had an itchy feeling. So your throat chakra is your seat of communication, and this can tell us that you're having some issues communicating either to yourself or to somebody else what you need or what you want. And there was also a little bit of that prickliness in your root chakra, which oftentimes will ground us to the earth. So it also is linked to your sense of identity. So there might be a little bit of turbulence in that area of your life as well. Okay? So let's go ahead and I want to check in on that a little bit. So what I have here is some chakra palm stones. Very colorful, very beautiful. And what we're going to do is we're going to kind of meditate on these a little bit. And we're going to figure out if there is something going on in that chakra based on what you feel, what you report back to me. So let's go ahead and start with the root chakra, okay? So I'm just going to take this stone and I want you to hold out your hand. I'm going to place this in your hand and I want you to hold it and close your eyes and tell me what you feel. This could be actual physical sensations like coldness, warmth, itching, burning. Could be emotional sensations as well, certain emotions. Okay? Just tell me a little bit about what this feels like to you, what this stone feels like in your hand. Okay. All right, I'm going to take that stone and I'm going to put into place your sacral chakra right here. So I'm just putting that in your hand. You can take it, you can wrap your fingers around it. Just let me know if you get any physical or emotional sensations from this stone. Okay? Yeah, you don't have to think too hard about it. If there's nothing, there's nothing. Okay? There doesn't always have to be anything. All right. Okay, let's go ahead and grab your solar plexus. It's a real pretty yellow color. Let's see. Okay. So take this stone. Just think about it for a few moments. See if there's anything that comes up at all. Anything off. Okay. All right. Okay. Let's go ahead and move on to your heart chakra. Okay. So, anything coming up at all? Okay. All right. Okay. And let's go ahead and move up to the throat chakra. Okay, as I place this in your hand, do you feel anything at all? Anything physical? Anything emotional? Okay. All right. And let's go in with your third eye right here. Okay. Just take that stone and tell me if there's anything that goes along with the feeling of that stone. Okay. All right. And lastly, the crown chakra here. Okay, anything going on in this area? Okay. All right. Okay. So I'm going to put these back. All right, so there's certainly some congestion in those three chakras primarily. And I'd like to do a little bit more investigating. Okay. All right, so I'm just going to note that down. Very good. Alright, so let's do a little bit of investigating here. So I've got magnifying glass and a pen light. And we are going to quite literally take a look at your chakras, okay? You can keep your eyes open, you can keep them closed, doesn't matter to me, okay? But we're gonna do a little bit of investigating. So I'm gonna start with your third eye here. So I'd like to take a little deeper look, little deeper look into your chakra centers. I just want to see if there's anything in particular that's going on that we can note physically. Okay, and we'll move down to the throat chakra and just see if there's anything physical that might be going on that we can pick up with our magnifying glass and our pen light. Okay, and then the root chakra is going to be a little tricky, so I'm going to be a little bit away from it. Okay, and I'll just do my best to ascertain if there's anything that we would have to examine in closer proximity. There generally isn't, though. Okay, all right, I'm gonna put that down. Okay, so how you doing so far? Yeah, it's a little bit interesting having your chakras examined, isn't it? Yeah, so I'm just gonna note that down. Okay, so I didn't find anything physical that was going on. Have you had any headaches, any sore throats, any sort of issue at all besides what you already had told me? Okay, now that you think about it, a little bit of the headaches. Okay, I'm just going to note that down. Okay, very good. So you're thinking that might have been allergies? Okay. That is certainly possible. It is that time of year, but we just want to make sure that we have all of our facts. Okay. So now I want to do a little test, okay? And I'm not going to hit you, not you directly at least. What we're going to do is what I like to call a little bounce test with the reflex hammer. And what I want to do is I'm going to be putting my fingers on your chakra point and tapping on it and seeing if there is any or what the response is back from that when there's that direct stimulation on your chakra point. Okay? All right. Doing okay? Okay, yeah, some people kind of cringe a little bit at the pounding of the chakra kind of deal, but it's very gentle. It's not going to hurt at all, okay? If there's any pain, just go ahead and let me know, all right? Okay, so I'm just going to go ahead and go through all the chakras while we're here, okay? Even the ones that we're not super concerned with. All right, so we have the root chakra. So I just have a couple of fingers along that, and I'm just going to tap on them. Okay, and we're going to move up to the sacral chakra. then the solar plexus. Okay, and the heart. All right, and the throat I'll be very careful with. Okay, and with the third eye. Okay, and then we're going to do the crown. Okay, very good. So there wasn't really any rippling or anything out of the ordinary there, so that's good. As I like to say, there weren't any adverse reactions. So now let's go ahead and focus on a little bit of treatment, a little bit of support in those areas. So what I have here is a tuning fork and a little hammer. The tuning fork is at 512 hertz. Now, your chakras most respond to different hertz points. However, this 512, we're not aiming to, cure anything by hand today. That would require a little bit more individualized. As I said before, each chakra likes its own sound, but this is going to be more of a support until we can get you in to see maybe some therapies that might help alleviate those problems for you, okay? All right, so I'm just going to be striking the fork. You can keep your eyes open, you can keep them closed. We'll do some deep breath work while we're doing this, okay? All right, so root chakra first. Take a deep breath in for me. And out. Deep breath in. And out. Deep breath in. And out. Okay, let's work on that throat chakra. Deep breath in. And out. Deep breath in. And out. Deep breath in. And out. Okay, and we'll do the third eye. Deep breath in. And out. Deep breath in. And out. Deep breath in. And out. Good. Now I'm going to be running the tuning fork over all of your chakras now, just so that we're not leaving anybody out, and if they need a little bit more support, then they can get a little more support. If you'd like to take a deep breath in and out. Deep breath in and out. Deep breath in and out. Okay, there we go. Okay, so I'm just going to be holding my hands over each of the chakras and just giving you a little bit of energy, okay, to just further help support those energy centers and further work on that stagnation, okay? So if you want to close your eyes, if you want to keep them open, it's okay. We're going to start with your root chakra. And just giving you some bright, light energy. Help that deep red chakra open up and allow energy to pass through. And the sacral chakra, that rich orange color, just giving it some time and some energy to open up. And the solar plexus, brilliant yellow color, just giving that some healing energy. And your heart chakra, lush green color, giving that some healing energy so that it can open up. And your throat chakra here, a rich, deep blue color, just giving that some energy to allow it to open up and heal. Your third eye, which is a pretty rich, deep indigo color. Just allowing that to open up and accept this healing energy. Your crown chakra, which is this beautiful royal purple color. Just allowing that to accept this healing energy and open up. Okay, there we go. So, how are you feeling? Okay, I hope you're feeling at least a little bit more calm, a little bit more centered. Okay, so let's start talking about some therapies, okay? So, let's see here. Recommended therapies. So we had talked about that healing touch session before, right? So something else that might be a good idea, I'm thinking that maybe a naturopathic session may do you well. And these are all suggestions. If you want to get them scheduled, if you want to sign up for them, that's all on you, okay? I'm not going to make that decision for you. It's what you want, all right? I'm not going to force you into anything. Possibly an esoteric healing. So I'm going to just note that down. That's a maybe. Let's see. What else could we do? So a good Reiki session can help clean all that out. So So that would be a good option as well. Let's see. Is there anything that you have been thinking of? Anything you've been curious about? Okay. All right. If you are and you have any questions, you can always give me a call, okay? And I can look into different things for you. All right. So let's see. We've got 4. I want to round it up to an even 5. Let's see. What about a crystal therapy? That might be interesting. That would certainly help with the chakras. Yeah, and I think since you had some pretty decent reactions to those palm stones, yeah, I think that's a good idea. Okay, I think overall, that might be a good start. Okay, so is there anything in particular that you'd really like to start with? Okay, so out of those, that's what really spoke to you. All right, that's good. So I can certainly get those scheduled for you, and I can let you know how that goes. Okay? Yeah, and what was, let's see, phone number and email, right? Okay, so would you mind just reiterating that to me? I know I have it in your file. I just want to make sure that everything's still okay. Yep. All right. Okay. Very good. And the email? Okay. Okay, very good. So then I will get a hold of you when I hear something, okay? You have any questions at all? Anything that you're concerned with? Okay. Yeah, again, if you have any questions, any concerns, you can always give me a call, shoot me an email, all right? And we'll do our best to get that addressed for you, okay? All right, is there anything else I can help you with? Okay, very good. So let me go ahead and just sign off. Okay, excellent. So, very good. So I'm going to go ahead and shut that down, and I think that'll be it for our session today, okay? All right. It was so lovely to see you again. I really hope that I was able to help you, and we're going to get you right on track, okay? All right. I hope you have a whale of a day and a good rest of your night.